My name is Robert. I'm this type of guy that cares about a whole bunch of people and wish the world would change. That's who I am. In 2013, on February 14th, I was rushed to the hospital. My bodily functions were not working. I was paralyzed, and they found a tumor on my T8T9. And I was told that I had multiple myeloma. In my mind, everything was racing. Tears, crying like a baby, all the above stuff because of the fear factor of the word cancer.
I went through depression because I was afraid my husband was going to die, and I didn't want him to die.
2013, I had a stem cell transplant. So everything that they said I was going to go through, I went through. I went through old school chemo too, where I lost my hair, but the stem cell transplant worked. Everything in my levels were pretty much zero. After the stem cell transplant, I had a relapse.
I was in tears. I immediately thought about death because I was told that when it comes back, or if it comes back more aggressively.
My wife got upset. And so I talked to her and said, hey, don't worry about it. We're going to get through this.
After the relapse, the doctor, he let us know that we would use a different treatment than we did before because they use a different treatment when you relapse.
Everybody's journey is different. Everybody's treatment is different. But the combination treatment that they use for me is working.
Every time we go to the doctor, they give us hope and encouragement. His numbers are going down the way the doctor said that it would go down. So we're pretty optimistic about his treatment, the treatments that he's getting to treat multiple myeloma. Multiple myeloma has had negative and positive impacts on me and my husband's life. As a married couple, we are closer to each other. Our family has become closer. They give us a lot of support, and we have a great appreciation for them. And we are very passionate about awareness and educating other people about multiple myeloma.
Me and Sharon decided on starting a cancer fund, which targets the cancer multiple myeloma.
We go into the community health fairs, giving out information even at stores, just getting doctors to sit across the table from each other to talk about this disease. And so that's what we're out here to do.
You don't have to walk with multiple myeloma by yourself. Our attitude has to be that we're overcomers. But when we work together as a people, regardless of nationality or color, skin, or culture, then we can make a difference in this.
Indications. KYPROLIS, carfilzomib, is a prescription medication used to treat patients with relapsed or refractory multiple myeloma who have received 1 to 3 previous treatments for multiple myeloma. KYPROLIS is approved for use in combination with dexamethasone or with lenalidomide plus dexamethasone, which are other medicines used to treat multiple myeloma. KYPROLIS, carfilzomib, is a prescription medication used to treat patients with relapsed or refractory multiple myeloma who have received 1 or more previous treatments for multiple myeloma. KYPROLIS is approved for use alone to treat relapsed or refractory multiple myeloma. Important safety information. KYPROLIS, carfilzomib, can cause serious side effects. Heart problems. KYPROLIS can cause heart problems or worsen pre-existing heart conditions. Death due to cardiac arrest has occurred within 1 day of KYPROLIS administration. Before starting KYPROLIS, you should have a full medical workup, including blood pressure and fluid management. You should be closely monitored during treatment. Kidney problems. There have been reports of sudden kidney failure in patients receiving KYPROLIS. Your kidney function should be closely monitored during treatment. Tumor lysis syndrome, TLS. Cases of TLS have been reported in patients receiving KYPROLIS, including fatalities. You should be closely monitored during treatment for any signs of TLS. Lung damage. Cases of lung damage have been reported in patients receiving KYPROLIS, including fatal cases. Pulmonary hypertension, high blood pressure in the lungs. There have been reports of pulmonary hypertension in patients receiving KYPROLIS. Lung complications. Shortness of breath was reported in patients receiving KYPROLIS, Your lung function should be closely monitored during treatment. High blood pressure. Cases of high blood pressure, including fatal cases, have been reported in patients receiving KYPROLIS. Your blood pressure should be closely monitored during treatment. Blood clots. There have been reports of blood clots in patients receiving KYPROLIS. If you are at high risk for blood clots, your doctor can recommend ways to lower the risk. If you are using KYPROLIS in combination with dexamethasone or with lenalidomide plus dexamethasone, your doctor should assess and may prescribe another medicine to help lower your risk for blood clots. If you are using birth control pills or other medical forms of birth control associated with a risk of blood clots, talk to your doctor and consider a different method of birth control during treatment with KYPROLIS in combination with dexamethasone or with lenalidomide plus dexamethasone. Infusion reactions. Symptoms of infusion reactions included fever, chills, joint pain, muscle pain, facial flushing and/or swelling, vomiting, weakness, shortness of breath, low blood pressure, fainting, chest tightness, and chest pain. These symptoms can occur immediately following the infusion or up to 24 hours after administration of KYPROLIS. If you experience any of these symptoms, contact your doctor immediately. Severe bleeding problems. Fatal or serious cases of bleeding problems have been reported in patients receiving KYPROLIS. Your doctor should monitor your signs and symptoms of blood loss. Very low platelet count. Low platelet levels can cause unusual bruising and bleeding. You should have regular blood tests to check your platelet count during treatment. Liver problems. Cases of liver failure, including fatal cases, have been reported in patients receiving KYPROLIS. Your liver function should be closely monitored during treatment. Blood problems. Cases of a blood disease called thrombotic microangiopathy, including thrombotic thrombocytopenic purpura, hemolytic uremic syndrome, TTP-HUS, including fatal cases, have been reported in patients who received KYPROLIS. Your doctor should monitor your signs and symptoms. Brain problems. A nerve disease called posterior reversible encephalopathy syndrome, PRES, formerly called reversible posterior leukoencephalopathy syndrome, RPLS, has been reported in patients receiving KYPROLIS. It can cause seizure, headache, lack of energy, confusion, blindness, altered consciousness, and other visual and nerve disturbances, along with high blood pressure. Your doctor should monitor your signs and symptoms. Possible fetal harm. KYPROLIS can cause harm to a fetus, unborn baby, when given to a pregnant woman. Women should avoid becoming pregnant during treatment with KYPROLIS. Men should avoid fathering a child during treatment with KYPROLIS. KYPROLIS can cause harm to a fetus if used during pregnancy or if you or your partner become pregnant during treatment with KYPROLIS. You should contact your doctor immediately if you experience any of the following: shortness of breath, prolonged, unusual, or excessive bleeding, yellowing of the skin and/or eyes, jaundice, headaches, confusion, seizures, or loss of sight. Pregnancy. Women should not receive KYPROLIS if they are pregnant or breastfeeding. Any other side effect that bothers you or does not go away. What are the possible side effects of KYPROLIS? The most common side effects occurring in at least 20% of patients receiving KYPROLIS in the combination therapy trials are low red blood cell count, low white blood cell count, diarrhea, difficulty breathing, tiredness, fatigue, low platelets, fever, sleeplessness, insomnia, muscle spasm, cough, upper airway, respiratory tract infection, and decreased potassium levels. The most common side effects occurring in at least 20% of patients receiving KYPROLIS when used alone, monotherapy, in trials are low red blood cell count, tiredness, fatigue, low platelets, nausea, fever, difficulty breathing, diarrhea, headache, cough, swelling of the lower legs or hands. These are not all the possible side effects of KYPROLIS. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full product information on KYPROLIS Central.